Okay.
I don't know, Steve, but I'm going.
This is the left common iliac artery, which goes into the, obviously there's one each side. The external iliac artery goes through the femoral sheath into the femoral triangle and descends all the way down the thigh. But it has a branch called profunda femoris, which branches both transversely around the thigh, and it also has an ascending branch both medially and laterally, and also down here. So as it comes round, there's a superior gluteal artery, there's an inferior gluteal artery. You can see the greater trochanter is marked here. Then there's an ascending branch, medial circumflex, which comes round there. Thank you, Stacey. Very helpful indeed. And so this transverse branch here is the medial circumflex artery with its first perforating artery, cruciate anastomosis.
Yay!
Okay, so we descend. Sorry, yeah, and just to recap, the femoral artery runs down the adductor canal. Next, we move on to the genicular arteries, which are both superior lateral, inferior lateral genicular arteries, and superior medial and inferior medial genicular arteries. Okay, not sure what this is.
Fibular recurrent artery.
Anyway, we're going to move on to the anterior tibial artery, which comes from, you can't see it on this model, but it comes, as Sammy is over there, comes from the posterior. Actually, yeah,
Show us, Sammy.
we can see it, can't we? It comes from here. And where
That's
does
the
it?
popliteal artery, and then here, branching off here, top one, is the anterior tibial. Here.
Yes,
And then
this
the second one is the peroneal artery.
Yes.
So.
Brilliant.
So anterior tibial.
Anterior tibial comes down here, all the way down the leg, underneath the superior extensor retinaculum, underneath the inferior extensor retinaculum, here in purple, and then to the dorsum of the foot, it turns into dorsalis pedis artery, which has a tarsal lateral branch and a arcuate lateral branch, which also branches and feeds the digits of the foot. Oh, sorry, we need to just come to we probably should.
Should we go from popliteal?
Let's go from popliteal. Okay. So the popliteal artery, as you can see here, I'm guessing is forming anastomosis with the genicular arteries.
Yeah.
So the popliteal fossa comes down here. It's then the posterior tibial artery, which has then got peroneal artery off it. I think that is anterior tibial nerve, just not marked.
Yeah.
As we showed in the other model. So it comes down, these arteries feed the peroneals, and then there's a perforating branch here, which this will probably be on the exam, over to this model. Shown here. So that's the perforating branch of the perineal artery. It's not very easy to see.
Extreme close up.
Extreme,
Okay.
that's about as good as it gets. Okay, so it comes laterally, posterior around the malleoli, and has branches. Now there is, where are the, oh here we go, we need to do this one.
Posterior tibial.
Posterior tibial comes to the long plexus, down here, passes again posteriorly to the medial malleolus and branches into, comes underneath some, what is that? That's the superior extensor, or some form of retinaculum, I'm not sure exactly which one.
Or flexor retinacular, isn't it? Because that's extensor retinacular there.
So
Peroneal retinacular there. And that'll
so
be
it's probably, so extensor retinacular.
Yeah. So flexor retinacular.
Sorry, flexor retinaculum. Then it feeds the medial plantar artery and the lateral plantar artery.
Yep. Should we stop that? Stop there.
Stop.
Okay.